afternoon. It's August 11th, 2026, a Tuesday. We're at the Deuk Spine Institute. Our patient travels here from somewhere in Florida. She's had back pain for 15 years. 15 years. Now, when we did her Zoom call, it was very obvious the pain was coming from the discs at L3-4, L4-5, L5-S1. That's where she was pointing to. And I checked her for other areas, but didn't see any pain in the other areas because there are 30 specific causes of back pain. In her case, it appeared to be just the discs. But when she got here, she also had pain in her SI joints on both sides. So we call that SI joint pain. In total, she has 5 things causing back pain, 5 sources. All right, how's the stream going? Good?
Yes, sir.
While we're gaining access to the discs, which we're starting with, go ahead and show the audience the 30 different causes of back pain. I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us.
1.
And welcome back. Our patient is asleep and we're getting ready to do her discogram to verify which discs are actually causing her pain. And shot. Alright, we need to get into 5-1. AP. You've seen from our video there are 30 very specific sources to back pain. We know where the 30 sources of back pain are, and more importantly, we can fix them at Deuk Spine. The problem is, most doctors don't know how to diagnose this back pain and how to fix it, but we do. She was diagnosed on Zoom through a virtual consultation. She lives in Florida. When she showed up, it turned out she had 2 more causes of back pain, the 2 SI joints. You just saw in our video, the sacroiliac joints are a common cause of back pain. The most common cause of back pain, though, are disc injuries. She has 3 of them. 85% of all back pain, chronic back pain, comes from the disc. And she has 3 of them causing her pain. Is she awake? All right, we're going to wake her up and we're going to test these discs to see if they're painful, which we think they are, but we want to verify that. Any questions from our audience?
No questions.
All right, for those of you who have never seen the surgery, you're watching laser spine surgery. We haven't brought the laser in. The beginning of the surgery requires placing needles into the discs that are herniated, causing patients back pain or leg symptoms, and then we're going to use those needles to move forward and place a scope, which is an endoscope, and then we're going to visualize the annular tear, source of her back pain, followed by a laser to clean out the herniations that are causing back pain. So that's what we'll be doing with her. Before we do that, I want to do a quick discogram, evocative, to see just how painful these discs are. So we're waking her up just for a minute so we can do the test. While we're doing that, if you have questions during the surgery, type them up in your dialog box, and then we will try to answer the questions, okay? First part of surgery is fix 3 painful discs. Second part of surgery, the next surgery we'll do, is to fix the 2 SI joints. All right. As a reminder, she's had back pain for 15 years. No one has been able to get rid of it for her. 15 years of back pain. That's how we met. All right, we kind of need her awake.
Open your eyes for me, you okay? Yes. Can you say hello? Okay, she says responding to commands.
All right, good. You're doing great. You're awake just for a minute. We're going to put you back to sleep, okay?
You're doing great. Don't move your arms.
All right, so she's awake. Are you comfortable? Are you comfortable?
You having any back pain?
So folks, the key to the discogram working is the patient can't know when you're doing the test. So she knows we're going to do the test, but she doesn't know when I'm going to do the test, which is to inject the dye. So you want to be honest, to have a good result, you want to catch them off guard when they don't expect it. So the first thing we have to do is wake them up so they're awake. They're aware of the pain. The second thing we're going to do is test each disc. There will be 3 discs that we test. You're doing amazing. Lay still, okay?
Don't move.
Are you comfortable? All right, good. Are you having any back pain?
Any pain right now? No.
How bad is that on a scale of 1 to 10? How high?
Number.
10. Is that where you get pain? I couldn't hear what she said. Yeah, all right. So that's concordant. That was L4-5, folks. Jordan, show the audience, and Kimmy, go to the x-ray picture. You guys see the dye leaking out through a giant tear at the bottom of the L4-5 disc. That's where the pain is coming from. Is it better? Is it better?
A little bit.
All right. Are you still having pain?
No pain or yes pain?
All right. Is it better? So the pain comes from when you inject a little bit of this liquid into the disc. And the liquid is really just saline, but we also include a little dye to help with the surgery. All right, are you comfortable? Good. How bad is that on a scale of 1 to 10?
Give us a number.
How high? Shot. How high did it go? So, 12. Is that where you get back pain? Is that where you get back pain?
Where you get your pain? In that area? Yes.
All right. So we got 2 discs we tested, 3, 4, 4, 5. One is a 12 out of 10. The other is a 10 out of 10. Both are concordant, meaning that's where she gets her back pain. And that's why you need the patient awake for the discogram, so you can get that feedback from them, okay? You comfortable? How bad is that on a scale of 1 to 10?
A 10.
10? Is that where you get your back pain? Yes, okay. So, folks, she's English is not her first language. It's actually Portuguese. And she has done a great job of helping us. We now have verified her back pain is coming from these 3 discs. Remember, she also has the 2 SI joints. When you wake up, that pain will be gone. Congratulations. Jordan, show the audience the tear in the back of the disc at L5-S1. It is huge. Look at that, top to bottom, above to below. The entire annulus is just ripped open. And that's where her back pain's coming from. So 3 discs, 3 posterior tears, and we're going to repair all 3 right now. I want you to count from 1 to 100 in Brazilian. Portuguese. Sorry. Take your time with her. Any questions from the audience?
No questions.
I'm going to remove the needles. We've placed the guide wire. Next, we're going to advance a dilator. You could see the tip is tapered. It slides down the guide wire right through a safe path that I created by placing the needle through a safe path to the spine. Let's have some num-num. All right, she's very thin. She has no fat in her body, and as such, you see that she's got a lot of definition. I like, as a surgeon, it's easier when the patient has a little bit of fat, but she's very fit. So it's a bit harder for me to do her surgery. How is the anesthesia on somebody who's very fit? Harder?
It's always easier to protect and maintain.
So Dr. Berndes says he likes it when people are skinny because the airway is easier to protect, which is true. Yeah, to keep the patient safe. So the patient has always two doctors here, one protecting her circulatory system, cardiovascular system, and lungs, and everything else. The other one, me, the surgeon, trying to fix something surgically. Any questions?
No questions.
So far, she's doing fantastic. We're very happy that the discs were positive for pain. Yeah. We had a 12 out of 10, which means that that disc was definitely painful. Well, all three were definitely painful. She confirmed it. All right. This is the part that most people have the most trouble with. It looks barbaric. We have to hammer the tube in. It's the safest way to put it in. So far, so good. She's doing really good. Let's show the audience how the disc becomes damaged and causes back pain.
Disc injuries start with an annular tear. Damaged nucleus, pulposus, herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that to get a herniated disc, you have to have trauma to your spine. Trauma in the sense of sports injury, like somebody forces you very hard to your spine and it gets pushed upwards or downwards and it tears the annulus. And then at the same time, there's a crushing of the nucleus pulposus just inside the annulus. The annulus is a ligament that holds the bones together called the vertebral bodies. It runs from the top vertebral body down to the bottom. It forms a wall that not just holds the bones together, but it also keeps the jelly or nucleus, the blue stuff here, inside the disc. You need this jelly to act as a shock absorber. And what happens is the jelly gets crushed, it fragments, and then it starts to make its way out through the tear within the annulus. Any questions about that?
No questions.
All right, then let's show our viewers how we use the laser to repair these disc injuries and get rid of people's back pain. Spine Institute.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Now, the neuroma's gone, but he has occipital neuralgia still. We're talking about a different patient, folks. I'm talking to my staff about a different patient. All right, any questions about how we use the laser to repair herniated discs that are painful, like this patient's?
No questions.
I think she's going to be very happy when she's done with her surgery. Again, we tested the 3 discs, and all 3 are definitely 100% positive, causing her back pain. She just confirmed that for us. She was awake, and she told us that each of those 3 discs were 10 to 12 out of 10 pain, and they were concordant, meaning that's where she gets her pain every day. Everyday pain. All right, any questions?
No questions.
All right. So we'll just work for a little while and then we'll show you another video. But right now, I have a tube. You guys see the tube right there. I'm inside that metal tube or straw. And it's a endoscopic tubular retractor. We have an endoscope in here. We use the smallest, narrowest, best endoscopic system in the world. And this endoscopic system is different than others. Other doctors that do quote-unquote endoscopic spine surgery are actually removing bones from your spine, bones and ligaments. Here you see the inflammatory tissue. We're not removing any bones from the patient's spines. We're not removing any muscle. We're not removing any ligaments. But other doctors that do what's called translaminar or interlaminar endoscopic surgery, also known as the UBE, biportal technique, or any type of translaminar endoscopic surgery, they're going to be taking out normal bone from your spine. Your spine needs that bone to support the weight of your body. You start taking bones out during spine surgery, you weaken the spine and destabilize it. So these doctors are doing these procedures and destabilizing people's spines without putting in any type of stabilizing instruments. They do that because patients don't want screws, rods, fusion. So they sort of trick the patient by doing a endoscopic translaminar approach, drilling away part of the lamina and facet, getting rid of the interspinous ligament, sometimes the supraspinous ligament, removing ligamentum flavum between the lamina, and then going in and doing a discectomy, which is different than what we do. A discectomy is a procedure where you remove the disc. We're not removing the disc. We're removing the herniation and only the herniation. We also do an annular debridement, which is not part of a discectomy. Other doctors don't do this, therefore patients don't get better. So a lot of people who get discectomies, whether they're microdiscectomy or endoscopic discectomy, they still have back pain afterwards. Discectomy is not a treatment for back pain. It never was. So people with back pain, when you go see your surgeon and they recommend a discectomy, they're going to end up giving you more back pain than you went there with. Their treatment is really geared towards getting the pressure off the nerve root. Okay, we call that radiculopathy when your nerve root's being pinched and you've got weakness, numbness, or tingling in your leg or arm. So when the surgeon tells you discectomy or laminectomy or whatever they're recommending, what they're going to do is remove normal parts of your spine that you need to go and unpinch a nerve. So they want to try to treat your weakness, your numbness, your tingling, or your sciatic pain. And a lot of times discectomy can be successfully used to do that. Sometimes laminectomy works for it as well. But the best treatment in the world, the one that is the safest, the most effective, and does the least damage to your body, is the Deuk Laser Disc Repair. That's what we're doing right now. Our surgery here, our Deuk Laser Disc Repair, laser spine surgery, is done with a 7mm incision on the lower back. The other doctors are usually using 18mm incisions, so 3 times bigger. Our surgery is done without harming your muscles or your ligaments. Their surgery always damages your muscles and ligaments. Okay, they have to damage the muscle and ligament to do their surgery. We don't. That's because we go transforaminal. They don't know how to go transforaminal, so they don't do transforaminal. It's more complicated, a more sophisticated technique. It requires a higher level of training and understanding of the spine and the proper instruments to do it. These instruments we use are very expensive. The instruments they use are, in my opinion, far less expensive, cheaper, but also they don't work as well for the surgeon or the patient. So there's a big difference between what we do at Deuk Spine versus what other doctors are doing elsewhere. We're curing pain, they're creating pain. All right, let's show the audience why the Deuk Laser Disc Repair is the best treatment for back pain or leg pain or sciatica.
Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk Laser Disc Repair. We've been performing the Deuk Laser Disc Repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening.
All right, welcome back. So we've just completed L4-5 on the left side. We fixed the annular tear, cleaned it up, got rid of the back pain at L4-5. And what I noticed about the disc was there was a lot of scar tissue in that disc, meaning that this problem has been going on with inflammation for many, many years, at least 10 years in that disc. She's had back pain for 15 years, so it lines up with her complaints of back pain. One of the biggest problems today in the world is that people with back pain are often marginalized by their family, friends, co-workers, and society as a whole. Because doctors cannot usually diagnose the cause of back pain, they tell patients that they're imagining it, it's all in their head, and they make patients with back pain feel terrible about themselves. And this is wrong. And for the first time in history, we now know that people with chronic back pain do have, do have a source to their back pain. And that's what we showed you earlier. 30 specific sources of back pain. It turns out back pain is highly localized, meaning that patients can tell exactly where it's coming from. They'll point to it. And the reason for that is that back pain is mediated through what are called somatic afferent sensory nerves, somatic afferent. And somatic afferent sensory nerves are nerves that start in your lower back, and they travel up to your brain through a multi-nerve pathway that synapses eventually on your sensory cortex, the primary somatosensory cortex. The primary somatosensory cortex is the part of your brain on the surface that processes pain information and gives it an address in your body where it's coming from, and a very specific address. Just like FedEx, they know exactly where your house is, so they can deliver it directly to your front door. Well, there are two types of pain in your body. One type of pain never makes it to the consciousness. It's subconscious, and it goes to parts of your brain that process subconscious pain signals, like your medulla oblongata, your pons, the midbrain. And those areas are pain signals that you never are consciously aware of. But they have an effect on your heart rate, your respiratory drive, your anxiety levels, your depression levels. So they have widespread effects on the brain, on your personality, on your mood, but they're subconscious, meaning you're not aware of it. Then you have conscious pain, such as highly localized back pain, and that's what we're fixing right now is highly localized back pain. When we do this, we also see people's mood improve. They lose their depression. We see their anxiety improve. Their anxiety goes away. So fixing their source of back pain not only improves their depression, anxiety, but also their cardiovascular system. Their heart rate goes back to normal. Their breathing goes back to normal. So much improves. Their quality of life and health improve. Now that is exactly where the pain comes from. You can see the pink color. That is inflammatory tissue. That's what we're here to remove. By removing that inflammatory tissue with the laser, we're able to give this person a pain-free life. All right, I know we have a few questions. Let's take them.
This one's from Donald on YouTube.
Hi, Don. Welcome.
Is it possible to fix scar tissue after having a cervical fusion 16 years ago? I live in Denmark and I have been experiencing pain and numbness lately. I also have issues with L4-L5. Thank you.
Yes, to answer your question, we can definitely get rid of your pain here at Deuk Spine. You'll have to travel to Florida to get rid of it, though. As long as you're prepared to travel, then we can get rid of your pain. As far as diagnosing the exact source of your pain, that's what I do. And I've never met anybody in my lifetime that is as good as I am at diagnosing pain. So you may be good, but I would like to verify that your scar tissue is indeed the source. The way we do that is I need to do a review with you called an MRI review. It's a free consultation. You can do it from Denmark. You don't have to travel to Florida for that. I will tell you exactly what's wrong, and I will tell you how we can get rid of your pain permanently for you. And we do that over Zoom. It's a 10-minute call, and it's free. We just have to schedule it. So the way you schedule it, you go to our website. Kimmy will put a link to our MRI review page for Deuk Spine, where you'll meet me personally. I will personally review your MRI, do a quick examination of your lower back or your neck. In your case, your neck. And I guess you have back pain too, so we'll do both. And then I'll tell you what's wrong and how we fix it. But everybody's back pain can be fixed. Everybody. There is no back pain or neck pain we cannot fix at Deuk Spine. It just requires the right diagnosis. And I can do that usually virtually with about 95% accuracy. About 5% I have to diagnose when you get here. So if there's something else going on, I may miss it on the Zoom, and I may pick it up when you show up in person. That happens probably 5% of the time. Great question. I'm almost done with this disc. I got another 5 minutes left here, and then we're going to go to the right L5-S1. All of the white stuff here is scar tissue that you're seeing. Now, the stuff way down there at the bottom does not need to be removed. It's not causing any problems. We don't do surgery to make things look good. We do surgery to make things feel good. So I don't do anything more than what we need to do to fix the patient's problem. All right. Any other questions? I know we should have at least one more question.
Yes, this one's from Flip on YouTube.
Hi, Flip on YouTube. Welcome.
Is the laser only removing scar tissue?
Yeah, great question. The laser is removing whatever I point it at and step on the pedal to activate the laser beam. As long as I'm pointing it at something, it will remove whatever I'm pointing it at. If I point at a bone spur, it'll remove the bone spur. If I point at scar tissue like this right here, I'll remove scar tissue. If I pointed at a piece of herniation, it'll remove herniation. If I pointed at a nerve, it'll remove the nerve. If I pointed at anything in the human body, it can remove it. It is that powerful. It can even melt steel. And it does melt steel, as a matter of fact. If you look at our tubes, you'll see marks where the steel has been melted. Okay? For example, look right there at 12 o'clock, and you can see where the steel has been melted right there. Okay? All right, I think we're done with this disc. Let me just check again one more time. Yeah. Great question. So the laser will remove whatever I want it to remove. Let me get a little bit more. Remember, this tear was at the bottom of the disc, right? And that's exactly what we're seeing. The tear is right there at the bottom. It's not the whole annulus that's torn, it's just the bottom. And I cleaned that up really good. So I'm happy with that. This is L3-4. We're done. We're going to move on to the last disc, L5-S1, right side. Keep the questions coming. Happy to answer them for you. All right, we've done 2 discs with 1 little cut. You guys see the cut right there? It's tiny. It's literally 7 millimeters. Okay? You see that? 7 millimeters, just as I said. That's why our patients go home the same day. There's only maybe 1 or 2 surgeons in the world that can do surgery like this. The rest of them require much bigger incisions. They cut your muscle, cut your bone, cut your ligament. They destroy your body while they're doing surgery, but not here, not at Deuk Spine. Our patients go home without pain meds. These surgeries, they take a Tylenol, that's it. 1 night Tylenol. And then they're up, walking around, going back to work, shopping, living a normal life the next day, usually. All right, any other questions?
Yes, this is from Donald on YouTube.
Hi, Don.
Just curious, do you teach your techniques to new students?
I'm teaching right now. Do I have other doctors come in here and train? No, not yet. I will someday, for sure. We need to get the technique out and more people aware of it. That's our first goal. That's why we stream these surgeries live, so people can become aware of it. I've also published the surgery results in our peer-reviewed journal system. You can look up Deuk Laser Disc Repair on PubMed in the United States. You'll see it. It's been peer-reviewed and published. We have 11 peer-reviewed publications. The procedure is FDA approved, but I have yet to train another surgeon to do the procedure. So that will happen someday. Shot? Great question. All right. I don't know what happened there. All right, hold on a second. Let me just see. All right. So let's see where we are. Hold on. Shot. Let me just think. All right, that's fine. Go. All right, we are inside L5-S1. This is the last disc we're going to fix on this patient. Remember, she's had back pain 15 years. We tested each of these 3 discs before we started, and all 3 were causing pain for her. That is 100% confirmation that this surgery is going to work. Okay? This surgery only fixes pain from a damaged disc. And she has 3 damaged discs, and all 3 are painful. When we're done, we're going to move on to her 2 SI joints. Keep that sterile, Jordan. Any other questions?
Yes, this one's from Flip on YouTube.
Hi, Flip.
Is the incision stapled afterwards?
Yes. All of the incisions receive a staple. We don't do suture. We use a staple. The staple comes out the next morning when the patients come back to see us, in clinic before they go home. So the patients do the surgery. They go home an hour later. Well, many of them stay in hotels because they travel from around the world. And they go spend the night in the hotel after surgery. They don't spend it in the hotel, but they go to dinner and do whatever they want to do. They just cannot drive a car. You cannot drive a car the same day as your surgery. So they have to stay locally, and they come back for a quick 5-minute checkup in the morning. I answer questions. They usually thank us for curing their pain. Maybe we do a video testimonial if they have time, and then they're gone. And we never see them again. 1% will re-herniate. They'll have a second herniation right where I did surgery. That's 1 in 100, and they have to come back and get a second surgery. But it's always because they did something they weren't supposed to do. Usually bending over, picking up something heavy. That's the most common reason, too soon. Remember, 1 year after the surgery, you can do whatever you want. But in that first year, you have to be careful not to pick up anything over 50 pounds. It's when people start picking up, 80 pound, 100 pounds at work or whatever it is they're doing, then they start getting into trouble. They get a herniation again. But only 1 in 100 people are going to re-herniate. That's our number. We've done almost 3,000 surgeries in 20 years with the laser, and we only have 1 out of every 100 that will re-herniate. So, any other questions?
Yes, this one's from JMC on YouTube.
JMC on YouTube, welcome.
What is arachnoiditis?
It's a great question. So, arachnoiditis is inflammation of the arachnoid. The arachnoid is a naturally occurring normal membrane that wraps around your nerves and your spinal cord and your brain. So it wraps around the nerve, spinal cord, and brain. It's called arachnoid because it looks like a spider's web. When the early pathologists, hundreds of years ago, when they started dissecting people's bodies open and looking at things, studying them, trying to describe them and write down what they see, their observations, they described the arachnoid as being like a spider's web. So they called it the arachnoid. It's a normal membrane that wraps around your nerves, your spinal cord, and your brain. Now what happens is, and this really upsets me, by the way, is there are doctors today that still order a test called a CT myelogram or a myelogram. And with the myelogram test, they stick a needle in your spine and they inject a dye. That dye causes arachnoiditis. Okay? So people get arachnoiditis from that test. That test is 100% unnecessary. Do not ever get a myelogram done. Neither a CT myelogram or a regular myelogram. You don't need it. The doctors are doing it because they make a lot of money doing that test, but they put patients in harm's way. So I strongly recommend you avoid it if somebody tells you to get a myelogram done, whether a CT myelogram or an X-ray myelogram. Okay? Don't do it. That is the most common reason people get arachnoiditis. Other reasons people get arachnoiditis is from surgery. Let's say the surgeon goes in and accidentally punctures the arachnoid. Then they can get hemorrhaging, bleeding, which then causes arachnoiditis. Blood is a very, very strong inflammatory promoter. It promotes inflammation. So if you get blood around your nerves, your body will react by doing inflammation. Arachnoiditis is not curable. There's no way to fix it. But I will tell you this is the important part. If someone told you you have arachnoiditis and that's why you have pain, do not believe them. Come and do a free MRI review with me. I have never seen arachnoiditis cause back pain. Never. It does not cause back pain. It may cause a burning in your legs that's nonstop. Burning in the legs that's nonstop. That is the symptom of arachnoiditis. If you have back pain, it's not coming from arachnoiditis. If you have weakness, numbness, tingling, it's not coming from arachnoiditis. If you have pain that changes with position or time during the day, it's not coming from arachnoiditis. So don't give up, and don't give up hope that you can be fixed because some doctor misdiagnosed you with arachnoiditis. Let me diagnose you properly, and I'll tell you if you have arachnoiditis and what can be done about it. All right, we got about 1 minute left. If you have questions, type them up. Otherwise, we're going to be done, and we're going to move on to the SI joint. Now look at this inflammation right here. You guys see the pink? That's like a zit right there we just popped. By removing this, we're getting rid of the source of pain in her lower back. I just got rid of her pain source. Now, what caused the inflammation is this piece of herniation right here. You guys see it? I'm removing it. Remember, the laser fiber's 1 millimeter is a reference. 1 millimeter wide, 1 millimeter diameter. So think about how small this really is. It's only a couple of millimeters. Most doctors can't see this, therefore they can't fix it because they don't know how to do endoscopic surgery. All right. Any other questions?
Yes, this one's from Darren on YouTube.
Hi.
Why is Switzerland always at the top of the list of the best medical care and the US is at 15th?
Yeah, right? That's insurance companies, my friend. That's why. Insurance companies have ruined the American healthcare system. They've stopped paying doctors and hospitals and put them bankrupt. Remember, the insurance companies have one goal, to make profits. And we have one goal as doctors and hospitals. Well, we're supposed to have one goal, and that's to fix our patients' problems and keep them healthy. Those goals they work against each other, okay? Because treatment costs money for the insurance company. Therefore, if we treat patients, it's going to cost the insurance companies more money. Switzerland, I don't know how their healthcare system works. I don't know how it's paid for, but they don't have corruption like we do, obviously. They have very high taxation, Dr. Berndes says. I don't really have a great answer.
They're robbing Peter, the patient, to pay for him.
Yeah. Berndes says that the taxes are very high, so the government taxes people and then pays for their health care. But I don't know the details. I can't really comment on Switzerland. I can tell you in America, the insurance companies are robbing the people and our government, and they're not giving patients the medical care they need. Okay, we are pretty much done. That's it. There's the tear. Look how tiny it is. By cleaning out the herniation from the tear has collapsed down, and it's like almost completely closed. It's going to take about a year for it to heal all the way. Okay? Thanks for joining us. We're going to end the stream. Are there any other questions before I end the stream?
No questions.
All right, we'll be back in a minute or two with the bilateral SI joint plasma rhizotomy, which is a permanent cure to SI joint pain typically.